What we attempted to do here was provide an outline for busy clinicians who are taking care of patients with post-COVID conditions or long COVID in their clinical practice. We provide information on how common long COVID is, tips for early recognition, tips for physical examination and workup so as to eliminate other conditions, and some guidance for medication and treatment options. Hi, I'm Dr. Ravindra Ganesh. I'm an assistant professor of medicine in the Department of Medicine, and I'm also the medical director of the Post-COVID Care Clinic. I would like to introduce you to the Mayo Clinic Proceedings concise review on post-COVID conditions. In this review, we provide a primer for clinicians on what long COVID is, how often people get it, and what are the good historical and physical exam signs that could help clinicians make this diagnosis. Additionally, we provide some guidance as to what therapies may be helpful for patients and how to interact with patients who are having this very difficult condition, often without positive lab tests. We further provide some guidance on how to evaluate for other mimics of long COVID that could occur after infection with COVID. Now, 10 to 30% of people who develop acute COVID will continue to have symptoms beyond 28 days. This is known as long COVID or post-COVID conditions. This condition is debilitating for many patients and can take many forms. Common symptoms include fatigue, shortness of breath, chest pain, heart racing, dizziness with standing, brain fog, or aches and pains in unusual places, among other symptoms. In terms of what this means for patients, it's been really difficult for patients to access care for long COVID, given that so little is known about this condition. There's not very much available in the way of clinical guidelines or randomized controlled trials. So this primer can really help patients and physicians to make decisions as to whether this really is long COVID and how best to diagnose and treat going forwards. There is still a lot of work to be done in the field of long COVID. We're still not really sure as to the exact mechanism by which it is caused, who is going to get it, what symptoms an individual person will have, and how long it is going to last. This is a topic that's being researched by a lot of groups, and we're committed to bringing the science forward to patients as soon as it comes available. We will attempt to update these guidelines as often as we can going forward. In conclusion, I would like to invite all of you to read our concise review, which will be available in the July 2023 issue of Mayo Clinic Proceedings. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.